Namaskar, Ahara Arogya Adhyatma, the light of Samskara. Today we have Padma Shri Dr. C.R. Chandrasekhar. He is a renowned psychiatrist. More than that, he is a prolific writer and he has written hundreds of books and booklets for the public to bring awareness. And apart from that, he's the retired medical superintendent of prestigious NIMHANS, and now after retirement, he has been continuing his service by training the students in the schools, colleges, and other places. And let us welcome. Today, he is going to tell us about the fear. Actually, fear is one thing which can kill anybody. In fact, it is said, abhihi, abhihi. It is said, the one who is fearless, he survives. But one who fears, he dies early. So let us listen from the horse's mouth what Dr. Chandrasekhar is going to tell. Welcome, sir.
So fear is a common phenomena, negative emotion. All of us do experience fear of death, fear of becoming disabled, fear of losing money, fear of losing our girlfriend or boyfriend. So fears may be anything. Fears may be anything. So to this list, fear of death, fear of losing money, fear of losing our kith and kin, and fear of losing the job. So we have fear of disease. This we call disease phobia. Yes. See, to such extent, fear should be there because if you are fearful, immediately you will go to a doctor and take treatment.
You can be careful and prevent the disease. Yes.
Yeah, and if you think that yes, there is a family history of heart attack, what should they do? So with that fear, if you go to a cardiologist, they will tell you how to prevent heart attack, how to prevent epilepsy, how to prevent head injury, how to prevent gastrointestinal disorders. So fear will make us to take precautions to prevent diseases. But unfortunately, what happens? People do not fear about the causes of like alcohol, smoking, or using ganja, or very sedentary life, no walking, no talking, simply keep quiet and keep on eating.
They are not bothered about that, but they are bothered about death. Yes.
So they don't have fear about factors
that reduce practical causes.
Reduce disease, but they fear about symptoms. If I have fever, I will think that I may have typhoid. If I have chest pain, I think I have a heart attack. If I have a pain abdomen, I think that something is wrong in my abdomen. I may have ulcer,
appendicitis, or pancreatitis, all gallbladder stones.
Pancreas, all those things. So I request all people to, if you get a symptom, whether it's a fever, whether it's cough, whether it's pain or numbness or anything, immediately go and contact a nearby general practitioner. Don't rush to a specialist. Because if you go to a specialist, he will unnecessarily do all investigations to rule out very uncommon diseases also, and they will increase your
fear. He will think according to his subject. He will not look at other things. Yes.
Microscopically, he will look into one organ. If it's a cardiologist, he will look into only into the heart. If it's a gastroenterologist, only will look into intestine or stomach.
He will not look into everything.
Whereas the general practitioner, he will look into body as a whole as well as mind. Many symptoms are psychogenic. Like headache is a tension headache, psychogenic headache. Or numbness or weakness
and
is
chest pain also can be psychogenic.
Psychogenic. Anxiety and depression. So depression is one of the most common cause of physical symptoms, what you call somatic symptoms of depression.
Yes, psychosomatic.
Many people go to any doctor, any hospital with a lot of somatic symptoms. They think that something is wrong with their body, but on examination, everything is okay. Then the doctor says, everything is in mind. Please don't worry. Take a tablet, either a tranquilizer or a vitamin. You should be all right. But people do not believe in that doctors. So they can keep on shopping. Go to one doctor, change to another doctor, change to another system. This is one category. Then other category is they believe that they have a disease. They believe that they have disease. They don't have a disease. Nowhere in the body, no organ in the body is having any problem. But they think that my heart is weak, my kidney is weak, my bones are weak, my liver is weak, and I
Hallucination,
have got I
hallucination.
got
Yeah.
hepatitis, I got HIV, I got this and that. So they believe it's a almost like a delusion. Delusion means
Yes.
firm false belief,
Yes. Illusion.
and
Yes.
yeah, delusion. This we
Hmm.
call hypochondriasis. Hypochondriasis, where the person believes that he's having disease and
Yes.
keeps on going to doctors, keeps on getting investigated many times, 3 to 4 times ECG a week, 3 to 4 times scanning per month, or name any investigation, they keep on getting it done, and they almost uh, pressurize the doctor to prescribe medicines or to pressure the doctor to
Especially
accept
they
that he's
come to
having this.
then get an
Yeah,
ECG, get an
yeah,
ECG. There is no heart
yeah,
attack, but they want an
yeah.
ECG. Yes.
They want the doctor to say, yes, you have a problem. If the doctor says, no, no, Baba, don't have a problem. Don't come here. You're wasting your time. You're wasting my time.
Okay.
You're perfect. Your heart is perfectly normal. Your brain is perfectly normal. But they are not satisfied. They go on shopping, and they're called hospital birds in our language. Hospital birds. They're
Oh,
always seen in the
okay.
hospitals and getting investigated, going and
Yes.
consulting many doctors,
And
and
they have a
not doing
big
any work.
file like this,
Yeah,
carrying the file for
yeah.
10 years history. Yes.
I'm not doing any work. No, I'm ill. I'm ill. I can't work. I can't get up early in the morning. I can't eat well. Though eat well, they think that I'm eating less. So this type of wrong belief and extreme fear of
Hmm.
they having a disease, they suffer a lot. They're called hypochondriacal patients, and many times the doctor get angry with them because they keep on pestering. Do this, do
Yes.
that, refer me to other doctor. So I request all the
So they will
people,
go to the
viewers.
quack, who will say, yes,
Ah,
you have, and then give something.
then they're so happy and they fall to their feet. Baba, please rescue me. Please make me alive and give any medicine you want. Any amount I will give you. Make me all right. And then another thing is fear about treatment. Fear about treatment. So now rampantly, almost like a pandemic, people
Hmm.
worry about allopathic drugs. Any drug you prescribe, they think that they cause side effects, severe side effect, they cause liver damage, they cause kidney damage, and they refuse to take medicine. Even epileptics refuse to take medicine. Your cardiac patients will refuse to take blood thinner or any other drug you give. And in depression, again, they stop taking. No, sir, I took for 1 month. Somebody said it causes damage to liver. I stopped it. Many life-saving medicines are BP patients refuse to take BP anti-BP tablets. So this type of phobia for allopathic medicines because
But there are
systematically other
another group opposite of this, sir. They come and request, give me the B complex injection, give me
yeah
the IV drip, give
yeah
me the glucose drip. And for
yeah
such people, we had one Dr. Lingaya,
yeah
a very, very smart person. At the moment, the patient you say, sir, start a drip for me, sir, I'll feel better. So, no, 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 no. In the other ward, patient asked like this, and I started the drip. The fellow started shivering, ooh, as if the bhoot has come. So don't go for the drip. That will make you shiver. The fellows will get fear, and then they say, no, no, it's okay. I'll
there is
eat
no
well, sir. Don't worry.
yeah. So fear about drugs and fear of surgery because any
Yes.
painful intervention.
Hmm.
Everybody has a fear of surgery because they think that they may die on the table, they may bleed excessively, or surgeon may not be efficient to take out the tumor or anything in the body. So they go with lot of fear, and the
Hmm.
studies have shown that if the person is having fear, more complications post-operatively. If the person is calm and quiet, bold,
Hmm.
then post-surgical complications are less. So it's a duty of the doctor to educate people,
Reassure them.
telling that, yeah, whether drugs, whether surgery, or unnecessary fear about complications of a disease like diabetes, or will develop gangrene, diabetes will develop heart attack, diabetes will faint on the street and fall and die, either because of hypoglycemia or hyperglycemia. They read somewhere, people read Google and unnecessarily start worrying.
Yes.
Unnecessarily start
Yes.
worrying.
Yes.
So I request all people not to read Google because whatever Google says may not be 100% true. So always read books written by doctors or see these
The experts in that
videos
subject. Yes.
done by expert doctors like you and like me. So there are more than 40 lectures on mental disorders by me. If you open YouTube, you will get every information about every anxiety, depression, schizophrenia, bipolar, any illness, you name it. So read good medical literature, which is available in Kannada. Go to any bookshop and see whether doctor has written or some layman has it. Because some people layman, they go to a library and start writing
They can
books.
write wrong things.
So avoid
Yes.
wrong things and unless scare people. So any disease should not look with fear. Let disease come because many diseases are 80% of diseases are preventable. So healthy lifestyle, good food, good exercise, calm and quiet mind, and the clean environment will avoid 80% of the diseases. And genetic will
And
take care that.
keep smiling what
Yeah,
may, and not to get
yeah,
stressed.
yes. So phobia means excess fear. It's a term used in psychiatry. Phobia means excess fear. So disease phobia is very dangerous. Or dangerous is not, it kills people. It makes people to suffer a lot unnecessarily,
Yes,
and they
yes,
take wrong decisions
yes,
out of fear because fear takes away our discretion. Fear takes
yes.
away our thinking ability, and you
Capacity.
take
Yes,
hasty decision or fall prey to quacks and other people who scare you.
yes,
So
yes,
good knowledge about diseases, good knowledge about medicines, good knowledge about surgery, good knowledge and trust in doctors very important. Trust the
yes,
way doctor you go and see, you pay him the fees, you listen to his words, take the tablets, and also many do's and don'ts. All doctors will tell what you should do, what you should not do regarding
yes,
any illness while taking treatment. If you follow the doctor's advice meticulously, disease will vanish and you will not suffer from any complications.
yes,
So this is my request. So we should avoid excess fear because of disease, excess fear about medication, excess fear about anything which affects our body, and then go to the right person and improve knowledge and be bold. Any even
yes.
cancer can be one if you are bold enough to take treatment
Face
and you
any
will survive.
challenge,
Otherwise,
even death
any
you can
cancer people say
overcome.
think that they are
Yes,
going to die next day. They're going to next
yes,
day. Similarly,
yeah,
heart attack, one stunt is put, they think that the second one will kill them.
yes,
So this type of unnecessary anxiety, people entertain, even educate people entertain, and they
yes,
should be. So we should be what is a health literacy. Health
yes,
literacy.
yes.
Health literacy is very important. We
Is
are
very important.
education
Yes,
literacy is there, degree is there,
yes.
PG, postgrad degree is there, but health literacy is zero in our country
Zero.
because people don't bother
Yes, yes,
regarding
yes,
causation of disease or treatment of disease and how to which doctor to trust. So develop the right attitude, fight against the fear, and you will be healthy and you'll survive and you will live for 100 years.
yes, sir. Thank you very much for wonderful advice that you have given. And in fact, let them fear about the complications of
Uh,
bad habits, ill habits, like smoking, drinking, ganja, and taking drugs. The death is very sure with that. You fear about that and don't go near those habits. But unnecessarily don't fear about the diseases which are not there. Or even if the disease is there, don't fear. You come to the proper doctor, get the proper treatment, and then be done with that. And more than anything, Jo dara o mara. You must remember, Jo dara o mara. But if you have a strong mind and then do the yoga, dhyana, and develop your controlling your mind and be calm and keep smiling, the things will be much better. So, thank you very much, Dr. Saab. You have given such wonderful insight into the fear in the minds of the people, and I'm sure by listening to your words of reassurance, they will be get rid of their fear. Thank you very much. In case they don't have time to read of the literature, let them at least see our Ahara Arogya Adhyatma, which gives them everything. So the expert doctors, the really wonderful doctors are advising, so they can also get the knowledge about it. So thank you, sir.
Thank you.
Namaskar.